Hello, everybody, and welcome back to the Love Your Dogs podcast. My name is Bre Drake. I am a nature aligned dog health educator and a certified holistic pet health coach. Today, I'm bringing back the amazing Dr. Judy Jasek because, as promised, she's coming back to talk about cancer and basically talk about what do you do? Not only, what is cancer? What are the main causes? How can we work to prevent it? What does potential testing and screening look like to catch it early? And then, what do we do when we get that diagnosis? Because I'd gone through it twice with my last two guys, very close together, both very different experiences. I was very calm and level headed with our older dog Anne's oral tumor and was able to step back and take time. It was less urgent. With Skip, he had hemangiosarcoma. He had a bleeding mass on his spleen. So I was very easily sucked into the fear spiral and did some things I regret. Not to say that who knows if they were really right or wrong, but the goal of this episode is just to let you guys know that there are options, that if you get that cancer diagnosis, if your animal is stable, just take a deep breath. Enjoy your dog, love on your dog, get some second opinions. Ideally, work with a holistic vet like Dr. Jasek or a homeopathic veterinarian and just try to peel back the layers, get the diet as clean as possible. And on that note, start as early as you can with the diet. Making all of those changes after there's a cancer diagnosis, obviously give your dog the best chance of living a longer life with a good quality of life. But if we just start to make those changes now and lowering that toxic burden, any imbalances that are starting to happen and shift, you can catch them before it becomes a cancer diagnosis. So remember that too. So the goal is to just help everyone have the knowledge that I wish I had when I was sitting in the exam rooms, both times just devastated to hear that my animals had cancer and not knowing where to go next. So hopefully this helps to get you guys prepared and get you being proactive now. And then if God forbid you ever deal with the diagnosis, just know there's hope. There's things you can do. It's not all doom and gloom. Many dogs can live many more years with a tumor, with cancer. I mean, we're cancering all the time. If we can bring a body back to balance, then they can coexist. And we touch on that a lot in this episode. And I apologize, I'm a little under the weather today, and I hope that doesn't come through too much. I was not going to miss this conversation. I'm a little bummed that I'm not my 100% normal self. But hopefully you didn't even know that, and hopefully I'm just selling myself out. But I wanted to apologize in advance. But I do feel like we covered a lot, and I'm really happy with the conversation, and I'm excited for y'all to listen.
How are you? Nice to see you
Good.
again.
You too. You're glowing.
Am I? Well, I'm playing with my lighting, but
Yeah, you look really not in a bad way. You just look like your
okay.
skin looks so nice.
Oh, thank you.
Yeah.
I'm a big fan of using tallow. I use a lot of tallow skin
Yes.
products,
Me too.
and
Me too.
I have really sensitive skin. Number
Yep.
one, but
Yeah.
it's just good for your skin. So
Yeah. I love the
yeah.
tallow too. What brand do you use?
I use lots of different ones. I actually have a friend that makes it,
Oh, that's
so I've been
perfect. Yeah.
using hers to support her, and I know it's all like grass fed and everything. She named hers after her dogs. It's Hazel's
Oh.
Botanicals.
Oh.
Um, and then I found a lady up at our local farmers market that was making
Yeah.
it. So when I find, I don't know, I just love to support these people that are making their own products that sit at the farmers market every week.
I
So
know. I know.
so I'll buy products, but they had a whole different line. Like they had one specifically for your face, and they had one
Yeah.
for, you know, skin, like in general and stuff like that, and all different scents of all different kinds of essential oils and stuff in there. So,
Yeah.
um,
It's
so
good
I always like
stuff.
to try. I just like to support people, small businesses, support my local economy. That's just
Yeah. I
brings me.
had a
That's like one of
major
my favorite
skin
things.
flare up thing probably 5 years ago, and I think it's because I was coming off a long time history of birth control too.
Yeah,
So ever since then, I will not put anything on my face that's not natural. It's tallow and aloe really is pretty much all I use from
yeah,
my own
yeah.
aloe plants. Yep.
Yeah, or anything else that rhymes. Yeah.
Yeah, anything else, tallow and aloe. Yeah.
Yeah, I have super sensitive skin, but
Mhm.
in some ways that's a blessing because then you just can't use
Yeah.
garbage on
And you
your
save a lot of money doing that
y-
too because
you s-
the beauty industry, oh my goodness.
yeah,
Makes me
yeah.
so upset how much they take advantage of women. It's
Oh, totally.
crazy.
Totally, for
So,
sure.
So we are talking about cancer today, as much as there's a million things I could talk to you about,
Yeah.
because I finally sat down and watched your rabies webinar and my mind was blown.
Oh, we could do another podcast sometime just on that. It's a big
Yeah,
topic.
it is.
It's a
It
big
is.
topic, and I think it's worth unpacking because there's so much fear around that, and that's
Uh-huh.
probably the one vaccine that it's really hard for people to get around because of the laws, but they're also just so afraid of it, and if
Yeah.
they really understood that it's just all a bunch of BS, I think people might be more willing to push back a little bit. So,
Yeah. I shared, um, it's called like a carousel, like a text information post on my Instagram with a lot of the things I learned basically about how vets aren't the vaccine police. And that went really well. People loved that.
really?
Yeah,
Oh,
people loved
good.
that. Because they do feel that way. And yeah, to some degree, some might report you and threaten you, but you got to know your rights. So, yeah, I listed out a bunch of the things I learned from your podcast and things I've been thinking of over the years. I'm like, yeah, they really can't force you at the end of the day.
No, and
Yeah.
they're under no obligation by their license to
No,
do so either. And if you
no.
actually read, the state board, so every state board has like a practice code or like a code of ethics or something that's available online. Anybody can look it up for their
Yeah.
own state. You can actually go in and read and look for this section. I mean, it'll be long, but
Yeah.
you look for the section on vaccines, and all the ones I've read so far say something along the lines of vets should be providing informed consent. No, nowhere have I read that, oh, you've got to vaccinate a pet before it even walks in the door. That's all just, it's one of those things that if enough people do it, it becomes the truth and it
Yeah.
becomes the status quo. Just like if
Exactly.
anything's said often enough, it
Hmm.
becomes the truth,
Yeah. Yeah.
Um, and so there's absolutely no justification for that. And I've never, ever heard of like the rabies police going door to door,
People think
confiscating.
they exist.
Yeah.
And the other big misconception is people assume that if your dog is rabies vaccinated, that they're safe and that they're somehow going to be excluded from the consequences. But usually they're going to, if they're suspected of rabies for a bite of another animal or a human, they're probably going to get the same treatment because
Yeah.
it's that big of a public safety concern. Yeah.
Yeah.
So
Yeah,
it's,
absolutely. And the
yeah.
other thing is, one of the big things, and we'll get on cancer here.
Yeah.
But
Yeah. I
I
know.
can tell this is a
But we're,
big
we're
soapbox, a
passionate
big
about this.
soapbox for me.
We're
This is like
passionate
a
about it.
prelude to when we do our deep
Yeah.
dive.
Yeah. Yeah. Yeah.
But one of the biggest things that the vets say is, or the reasons that they require it is for staff safety. So even if you believed that rabies existed and believed that the vaccines were protective, well, you don't get instant immunity. So vaccinating a pet on the way in the door, even if that were all true, that rabies were a risk and that the vaccines were protective, you don't get instant immunity. It takes 1 to 2 weeks
Hmm.
because you're building antibodies, you're mounting a response. So when you really break it down, it doesn't make any sense at
Yeah,
all.
and
So
besides all that, when the clock strikes midnight on day 365 or whatever that is
yeah,
times 3, it doesn't run out. So it's
it
just,
expired.
oh
So,
my
yep.
gosh, yeah, we can have a whole episode on that.
Yeah.
I love it. I've been recommending your webinar to so many people because it's something I wish I had known existed for the past couple of years, because it's something I always struggled with because I don't want to tell people to break the law, but I want them to have all the information. And you did such a great job laying all of that out. So now I have it. And now I'm sending it people's
Yeah.
way. And I'll probably just go ahead and link it in these show notes too so people can take a look at it.
Yeah. No,
Yeah.
that's great. I think the information needs to get out there and people need to realize it. And that's why we did it,
Yeah.
because it's just such important information.
Yeah.
So,
Because even these vets, they might look at it and say, oh, you know what? Why are we doing that?
right.
We're not
Right.
protected. This makes no sense.
Right. Go read your own practice code for your
Yeah.
own state.
Yeah.
And, when it comes right down to it, if they're not following their practice code, they're committing malpractice
Hmm.
by doing this.
Yeah.
They're not, because most of them will say, well, you should follow the vaccine manufacturer recommendations. A lot of state codes do say that. Well, it says right in there that's supposed to be given to sick pets. So what are you doing? And you're not telling people that it could potentially cause cancer, especially in cats. So
Yeah.
that's not informed consent. So they're really going against they're saying that they have to do this or they'll lose their license when really they're
Mhm.
actually violating their own practice code.
Right, and
So,
yeah, that whole discrepancy with the vaccine manufacturer saying for use in healthy animals only, and then the law is above that. I mean, it just doesn't make any sense at all. It's yeah, and, medical exemptions are only available in, what, a handful of states, and they're
yeah,
very rarely actually granted. Vets won't sign off on them
vets won't sign them, and
because they're scared for no reason.
vets don't acknowledge them either. I mean, I actually had a vet turn me and write a letter against me to the state board in Colorado because
Yeah.
I'd written a rabies exemption.
Oh my gosh.
And he
But you're
didn't feel
entitled to
like
do. Yeah.
right, but he didn't feel like it was valid. And it was for behavior reasons because this client of mine had a young dog. It was a mastiff, so it was going to be very big, and it was showing a little bit of fear aggression. And she said, because I have this big dog, I'm probably going to get the rabies shot. I
Yeah.
said, but wait, don't do it right now because rabies can change behavior, can actually cause aggressive behavior to come out in dogs. So I said, wait,
Yeah.
go get some training, get this kind of fear aggression, get the puppiness out of your dog and wait till it's a little bit more mature. So that's why I wrote
Yeah.
it, which I think is valid. But then she took the dog in for, I don't know, ear infection or something like that. And,
Mhm.
and they did it anonymous. It's like, come on, at least have some chutzpah to confront me
I
on it.
know, right? And
Like,
how does that person care? How is it ever gonna affect them in any way?
yeah,
Just makes no sense. Well,
like maybe they know they deep down they shouldn't be doing it. They don't want anybody else saying it
yeah.
because they'll have to change. Heaven
There's
forbid they might have to change the way they think.
I know. There's no telling with these people. So, let's just get into cancer before we get too carried away.
Right. There's lots of
So
rabbit holes we could go down.
I know, I know. I love it. I love learning from you. Um, so the cancer, gosh, it's always hard to know where to start with it. Do we start by saying maybe start with what you think are the biggest drivers right now? And because we know it's never one thing, but there's clearly a lot more dogs getting cancer, a lot more younger and younger. What do you think the main
Yeah.
drivers are and the best things we can do to try and prevent it, catch it really early?
Yeah.
Yeah.
Yeah. I think talking about, what I think cancer is and where it comes from is an important place to start
Yeah,
because
let's do
then
that.
people can get their
Yeah.
heads around it. Um, so what I think cancer is ultimately is toxicity.
Mhm.
I don't believe it's genetic. So I think is an important distinction in my opinion. A lot of times you'll just hear, well, every boxer's going to get cancer. Every golden retriever is going to get lymphoma. Like you hear these breed predispositions
Mhm.
that it's genetic. And I agree there could be some genetic predispositions, but then
Mhm.
there's also this whole epigenetics that cancer does not have to express, just like the BRCA gene in women. A lot of women get tested for this gene, then they go have mastectomies because it's going to prevent breast cancer, where if you live a healthy lifestyle, that gene won't necessarily um, express. But what I think it is toxicity. It's actually a survival mechanism for the cells. When cells become toxic and they can't adapt to their environment, um, they do this mutation. They change. Where they escape normal mechanisms. So every healthy cell has a programmed life expectancy. It's called apoptosis, which is a big word for cell death, where cells live a pre-programmed set amount of time. Like a healthy liver cell is going to live just a certain amount of time, and then the older cells die off, and then but they're dividing, and so new cells are coming in. So you always have regeneration. I think they said that most tissues in our body regenerate like every 3 months or something like that. So the tissues are constantly regenerating. Cancer cells, they escape all of that. So that's why tumors can grow out of control. They break all the rules. They can invade other tissues. And so I think it's some insult that the cells cannot otherwise adapt to. So they become cancerous. So what causes it? So I say toxic. So what causes a toxic reaction? It could be anything foreign in the body. So, we could start with poor nutrition. If you're feeding a diet that has even synthetic nutrients, which are just a bunch of chemicals, chemicals added to it, like, kibble diets that have grains in them that are sprayed with glyphosate as a desiccant because they spray like wheat and I don't know that they spray corn, but wheat. And I know like the legumes like lentils and garbanzo beans and all that are sprayed with glyphosate to dry them before harvest because it allows them to get into market faster. So if your pet's ingesting any of those products, they're getting a direct dose of glyphosate, which has been shown to cause lymphoma. And there's like a whole bunch of lawsuits. That's why the company is trying to get immunity from the government because they've got so many lawsuits now that they can't afford to stay in business if they have to keep paying all these lawsuits. So diet is an important form of toxicity. And vaccines, I mean, I consider vaccines toxins, like plain and simple. I don't think there's no health benefit whatsoever to giving a vaccine anymore, in my opinion.
Yeah, I agree.
Because there's so many ways to keep their
Mhm.
bodies healthy. What's that?
So I completely agree with you on that, and I wish
Yeah.
more vets were honest about that information. Yeah.
Yeah. Yeah.
Mhm.
They're toxins. And not only is it the antigen, so supposedly, when vaccines are made, their whole purpose is to inject a modified form of a virus or some pathogen that stimulates an immunity so that if the animal is exposed to that pathogen in nature, you'll have antibodies against it and will protect it. But then you get into this, but how is that thing processed? Like parvo, for example. So parvo, they somehow take the parvovirus and they modify it so it can't cause disease.
Yeah.
Supposedly, there's reports of vaccines also causing disease.
Mhm.
But the idea is that so they modify it somehow. But what is that? What is that procedure? How are they doing that? What kind of chemicals are they into? You don't know any of this stuff about vaccines. And now they're using this mRNA technology, and nobody knows what that is. Nobody knows what is going into these mRNA products except that it's bad and it's harmful and it's hurting people and it's hurting pets. It's just causing a lot of illness. And there's also the adjuvants. They put mercury and antibiotics and all of this stuff, and they put things like mercury in there because it causes a local reaction to stimulate immunity.
Mhm.
So how does this stuff contribute to cancer? Those are all toxins. Any foreign chemical, anything that does not come from the natural world is potentially a toxin. Any chemical, plus because they're designed to stimulate an immune response, I think they throw the immune system way out of balance so that when cells, do this toxic reaction and cells are changing all the time, and part of the immune system's job is to go in and clean up. It cleans up. That's like your lymphatics. It cleans up all these abnormal cells that we don't want, and then flushes them out. That's why, I cringe every time I hear an animal has had lymph nodes removed because
Those are
we
there
need
for a
that
reason.
drainage.
Yeah.
We need that drainage system, especially if we have a cancer diagnosis. And just because cancer cells show up in lymph nodes doesn't, to me, that's not metastasis. That's the body's trying to
Clean up.
clean
Yeah.
house. Yeah. And get things out of there. So we don't want to be disrupting that process. And I think that when young animals, especially, are given rounds and rounds and rounds of vaccines, I think we can permanently disrupt that normal immune system.
And
It
our
just,
cancer-prone breeds have those genetic mutations that often affect apoptosis and immune surveillance. So when you're artificially stimulating the immune system and bypassing all of those natural defenses and causing that confusion right out of the gate, I mean, it's like you're setting those poor dogs up for failure.
totally.
Yeah.
Totally.
Yeah.
And, breeders, anybody getting dogs from breeder, make sure that they're paying attention, that they're breeding for all aspects of health, not just a few characteristics and, like what people want to see in the show ring. Because sometimes then some of these other characteristics for health to keep dogs healthy in the long term get overlooked. I think the other biggie is environmental toxins, and this goes back to things like glyphosate. But, remember, dogs they got their noses down. Dogs like sniff for a living. Dogs love to sniff. They got their noses down everywhere. And if you're walking your dog where there could be herbicides or pesticides, they're breathing that in. They're getting it right on their feet, going inside and licking it off. So at least we wear shoes. If you walk in a neighborhood where there's nice groomed lawns, even if the little yellow flags, the only yards that have like the little yellow flags are when the commercial companies come. People go to Home Depot or Lowe's or something and buy
You have
Roundup and
no
come home and
idea.
spray it on their
Yeah.
yard. You have no idea.
I was thinking
You
the
have no,
other day, it should be the law that anywhere that sprays, even public places, should have permanent signage warning people that they've
yeah,
sprayed. We should know. We should be entitled to know that with all the lawsuits that are out there and the proof of the harm. Yeah, that's, gosh, one of my biggest pet peeves right now. It's what we're doing
yeah,
for wildlife and our dogs and our kids, humans. I
yeah.
mean,
You
yeah.
think about
Go ahead.
any sports field or any, public park that's all pretty and green and everything. They're just full of chemicals. And yeah, the kids are in there rolling in the grass and the dogs are. So I think fundamentally where, cancer comes from is toxicity. And, I'll mention the electromagnetics too. So cell phones, computers, are you underneath power lines where you live? 5G towers, data centers, hearing all this stuff about these big data centers that there's like a constant hum that it causes all kinds of health problems in people. People are moving away, just abandoning their homes and moving away because it causes so many health problems for them. Well, that stuff's affecting your pets too. And, turn off your Wi-Fi at least at night. Pets are really sensitive to frequencies. I think probably more sensitive than we are sometimes, or sounds, different sounds in the environment. So turn off the electronics, and it's going to make your family healthier too. Don't, have your even like just distance from your cell phone. If you have your cell phone on, just don't keep it away from you. Keep it away from your
Yeah.
pets.
Yeah.
Just keep them. Don't let your dog be like napping right by your computer tower, if it's on the
Yeah.
ground or something. So be aware of all those things because I think it's also multifactorial. It's never just one thing. It's probably a combination of things. If it's weak genetics and then all this bombardment of all these different things, um, and stress, think about what's a dog meant to do? Dogs love to get out and run and play with other dogs. And for some dogs, just that 15-minute leash walk a day isn't enough. And I know that's hard for people that maybe live in the city, but be thinking about it. If you can, a couple times a week, get your dog out somewhere where
Yeah.
they can run or play with other dogs or just,
Yeah.
just be a dog. If you're living in a concrete jungle, your dog's living in a concrete jungle. And I'm not saying people in cities shouldn't have dogs, but you just have to be aware that that's not the healthiest lifestyle for them.
Yeah, and it helps with the stress side of things, the boredom, but then also like moving lymphatic fluid and helping to process the toxins. I think dogs that have a very good amount of movement in their life can better handle a lot of this. And we'll get into how to mitigate
Yeah.
some of this later, but yeah, I just wanted to touch on that.
Yeah,
Yeah.
totally. And it's the same for people, I mean, I've never listened to a human healthcare provider in any discipline that has not said that time in nature is beneficial. It's recommended for everybody. And so get your dogs out, go for a hike, get your feet on the ground, get them off the pavement and the concrete and all of those things. So I think just creating this sort of healthy lifestyle and really thinking through these things, a lot of people are like, yeah, do the diet and don't vaccinate and all this stuff. But then, oh, turn my Wi-Fi off? Like, yeah, that'd be a little too inconvenient, but you got to do it all. Got to consider, all of the factors. And then, so anything else on that? I mean, those are probably my big things on what causes
Oh,
it.
spay
Any
and
other
neuter.
question? Oh, great one.
Yeah, yeah.
Great one. Um, so leaving dogs intact meaning not spaying or neutering. It's actually been shown, they've actually done research on this on the human side, the conventional side.
Yeah,
Probably true in humans too.
for
Spaying and
sure.
neutering is not have there's some
Yeah.
health benefits, but
Yeah.
on the conventional side, where they've shown that especially early spay and neuter is really not healthy because they need those hormones, the endocrine system. So this would be your thyroid, your adrenals, and your reproductive hormones, your pituitary. It's all interrelated. And you take out one part of it, you can affect the rest of it and affect the balance. And when dogs, I mean, in some rescues, I mean, they're spayed and neutered at like 6 weeks.
Breaks
It's
my
just,
heart.
it's
Yeah.
horrific. And you're really setting those pets up for health problems. And they've actually identified that they have higher risk of cancer, higher risk of endocrine disease like
Mhm.
Cushing's or Addison's, which are abnormalities of the adrenal glands, thyroid abnormalities, and they actually grow differently. Their growth plates actually stay open longer, so they get these really long, like stilted legs, kind of
Mhm.
stilted looking, because their legs grow longer, so that predisposes them to joint problems. But yeah, you have to keep them. It's all about natural health and remembering that the body is perfect by design. And it's just, we got to stop, interrupting that kind of natural flow and natural harmony that
Yeah.
exists by nature.
Yeah, we really have to think about why we're doing these things. I know, and I think in Norway, it's illegal to spay and neuter dogs conventionally, unless there's a valid medical reason. They know
Was
it's
that right? I didn't know
yeah.
that.
I think in Norway, it's actually against the law, and I think in other Scandinavian countries, it's strongly discouraged, where most of their animals are still intact. And they just have great education around dog guardianship in general. That's why they don't have the shelter overpopulation issues like we do, because it really isn't that difficult to manage intact animals
Hmm.
when you understand their cycles. But that's just another thing that's been drilled in our head that if we leave an
Right.
animal intact, there's going to be unwanted litters everywhere. And sure, accidents happen. You have to know what you can handle. But now we have what are your thoughts on the hormone sparing procedures? To me, it's like they're still surgeries.
Yeah.
Um, it's
You're
still,
still you're still altering the body.
mhm,
It's it's probably somewhat healthier because you're leaving some hormones there.
yeah,
So that's probably better.
yep,
In female dogs, you're taking out the uterus. So, A, they can't get pregnant. B, they can't get things like pyometras or infections in the uterus when they get
mhm,
older. But again, if they're kept healthy, the chances of that, I think, is way diminished, and having their natural cycle throughout their life is,
yeah.
part
And
of
same with,
that.
what about the cancer fear tactic? That if you leave an animal intact, they're gonna get testicular cancer and mammary cancer.
Right. Right. It's kind
Yeah.
of, I was taught that. I was taught in vet school that if you don't spay a dog by the age of 2, that they'll have a 50% chance of getting mammary cancer. And something like every year after that, the risk goes up by like another 50% or something like that. And they've debunked that too, the mammary cancer. And, I do see mammary cancer some in intact female dogs still, and it's all these other factors though.
Comes down
But
to
what else
lifestyle
is going
still.
on
Yeah.
in the body? Yeah, what else is going on? So yeah, that's a big I mean, obviously testicular cancer, if the testicles are gone, you can't get testicular cancer, but
Exactly.
that's
Yeah.
extremely rare in dogs in my
Yeah, and
experience.
usually you're better able to detect it, right? And it's more treatable, obviously. Um,
Right?
to me, what I've learned is that the cancer risk shifts from those more manageable cancers to the more aggressive cancers that are deeper in the body. We were talking about how the body is so smart. The body knows that it's going to store things or express in the least essential areas first.
Right?
And then when those are gone, those are like a cushion. And when those are gone, it can move deeper into the body if there's an imbalance. So it still just comes down to giving your dog as toxin free of a lifestyle as possible. And
Right.
then, for anyone that's keeping their animals intact, and well, I'll let you get into this, what you think about screening and when, but
Yeah.
that's something to do. If you keep your male dog intact, your female, just get into a routine of doing the appropriate testing and screenings to try and see if anything is happening. early. Yeah.
Yeah. Well,
Mhm.
yeah. And, for testicles, it's, easy,
Yeah.
just take a look,
Mhm.
get used to what's their normal size and feel. I mean, okay, it may
Exactly.
sound a little weird, touching your dog, but,
Yeah.
just normal, what the normal size and shape and asymmetry, that's probably a big one. If one's all of a
Okay.
sudden a lot smaller, one's a lot bigger, one feels
Yeah.
smooth, one feels lumpy,
Yep.
that sort of thing. Same with the mammary chain, you can't look at the ovaries and the uterus, but, um, you can feel down the mammary chain. Dogs will go through sometimes false pregnancies where they go through a heat cycle and they're not bred, but think their body maintains called the corpus luteum, which is what secretes progesterone. So the body thinks it's pregnant. So hormonally, the dog she'll develop milk, she'll do nesting behavior, she'll act exactly as if she's
Yeah.
pregnant, except that she doesn't have puppies. And then after 8 weeks, all that kind of goes away. So I mentioned that because that's another reason why that mammary chain could get a bit engorged and a bit enlarged.
Ah,
But no, the timing after that 8 week time after the heat cycle should all go down. So in cancer, when you're feeling like lumps and bumps in your dog, and this is kind of a generalization, but
yeah.
true malignancies are usually they're irregular and they're nodular, or they look angry, like lipomas, like these little fatty lumps. They're
Right.
smooth, they're kind of mobile, they move around, they're not like firmly attached. That's kind of another thing to kind of look for, because so it can just maybe touch into a little bit on testing. I
Yeah.
don't recommend sticking needles into things,
Yes.
so if you find a lump, I mean, I think it's a signal from the body. I think we have to think about, why are things showing up?
Mhm.
What are our symptoms? Oh my gosh, my dog has XYZ diagnosis.
Yeah.
I think we have to start thinking it differently. It's like, what's my dog's body trying to tell me? There's a message here. My dog has diarrhea, ate something's not supposed to. Body's getting rid of it. Wonderful. Isn't that awesome? Yeah, I had diarrhea all over the house, but my dog's getting rid of what it shouldn't have, Same with vomiting. Now if your dog's vomiting every hour, there could be something it can't get rid of, like a foreign body. That's different. But why do lumps and bumps show up? Again, we have something has changed in those cells. There's a toxicity in those cells, or like you were saying before, which I think is really relevant. So why do we look at like a pet's hair coat for indication of health? It's because if the pet's malnourished or compromised in any way, the body's going to favor all those internal organs, and body didn't care if the coat's shiny or not. It's
Mhm.
kind of the last place
Yeah.
that gets the nutrients. So we get little lipomas and little warts and this stuff that doesn't end up being a big medical concern, but it's
Yeah.
still a sign that something's out of balance. Um, what I was saying about the malignancies feeling more irregular, kind of lumpy, bumpy, ugly looking, angry looking. I mean, that's a generalization. I've seen some little like mast cell tumors that are, I mean, they're just tiny little bumps. You'd hardly even
Yeah.
know there's anything there. But as soon as you start poking at something, you're increasing inflammation. So I also, I mean, to me, toxicity, the reason causes an issue is that it spurs inflammation, which inflammation is a normal immune response. It's the immune system coming in there to try to resolve something. And when it can't, we get, chronic illness because the
Yeah.
immune system is not able to kind of mitigate the problem. Um, but when you start poking at things, you're creating more inflammation, you're
Mhm.
more toxicity, more cellular damage, all these things that are contributing to the formation of that lump in the first place, you're making that worse. And I've seen so many times where, especially like these little skin lumps, they'll
Yeah.
just blow up 3 to 4 times the size
Yeah.
after just a simple needle aspirate.
Oh my goodness.
Yeah.
Yeah. On that note, is it a good time to kind of segue into like what a patient coming to what would be ideal for a patient coming to you? a dog who they have suspicions of cancer, they haven't messed with anything yet, they haven't poked or prodded, is we feel like that yields the best results, right? Is supporting the
Yeah.
body and not starting to poke and prod and attack. Yeah.
Because from my perspective, it doesn't matter what the diagnosis is. So conventional medicine, they don't treat pets. They treat
Well, cancer.
diagnosis.
Yeah.
They can't treat with, all the chemotherapy protocols, which I don't recommend. They're all based on a specific diagnosis. So they're going to want to do that biopsy.
Mhm.
They're going to want to know, they could do all the staging. There's all this additional testing now that, in my opinion, really doesn't tell us anything. I look at a patient coming in, we've got a lump that's shown up somewhere. The pet's out of balance. So let's go through the routine. What areas of that pet's life can we improve? Number one, with diet, routine, environment, all these things we're talking about. And then there's certain specific things that we can do with herbs, ozone, mistletoe. There's different things that we can do to help. Now, sometimes the tumors are hidden, right? And we don't know until, so you've experienced this,
Yeah.
there's a bleed or
Mhm.
something happens, we don't know. So do you do routine screening? I mean, I guess that's an individual choice, you've been through it, so you might do it,
Yeah.
but it's also a trip to the vet. Most vets won't do ultrasounds without sedation.
Mhm.
So you're giving drugs, which I think is unnecessary to sedate, but
Yeah.
um, sometimes you don't know if things are brewing internally unless you're doing, some basic testing. So I guess that's a personal choice. There's just, man, there's no right or wrong there.
Yeah.
I think pets do pick up on our energy. So I think if it's something as a human you're living in fear of, probably good to do the test, because I think the pets pick up on that fear.
Yeah.
And you're like, oh, I'm so worried about this happening. If you believe, hey, I'm keeping my pet healthy and we're doing the best we can, and they're just going to live a happy, healthy life,
Mhm.
But there's just never any absolutes. And some things will be in there brewing without symptoms.
Yeah.
So that's a tough one. There are blood tests. There's a test, this VDI lab, they test inflammatory markers,
Mhm.
and they have like a little algorithm. They test some inflammatory markers and vitamin D, and I
Yes.
think thymidine kinase. And
Mhm.
I used those for a while. I didn't find that they correlated all that well with the progression of cancer. Like, I was using it in cancer patients to kind of monitor response to treatment,
Mhm.
and I just didn't feel like they correlated all that well. I think checking for inflammation could be valid, though.
Yeah.
So, like, there's CRP is like a common inflammatory marker. So doing basic blood work, looking for, like, there's no specific blood test for a specific type of cancer, but if you do basic blood work and you have an elevated white blood cell count, that could mean a lot of things, but that might be like, okay, maybe it's worth doing that ultrasound because you got this elevated white count.
Yeah.
Elevated calcium, that's a real big one, because in lymphoma, anal gland carcinomas, there's certain types of cancer and thyroid carcinomas,
Mhm.
there's certain types of cancer that very characteristically cause the calcium level to go up. So you could do the basic blood work and see how that shows up. And you could check like the inflammatory markers and just see, because I think as far as gauging inflammation, they can be valid. As far as, like, I don't know, assessing cancer risk, I'm a little bit on the fence on that one, because I just
Yeah.
haven't seen a real positive correlation. But I guess the bottom line is, if you see anything that's off on your basic blood panel, so say you do basic chemistry, liver enzymes are elevated. Well, it's going to indicate, you know, possible inflammation of the liver, which could be from a lot of different things. Sometimes they'll just go up transiently,
Yeah.
but that might be another thing. You say, let's do the ultrasound. I mean, I've seen a lot of tumors of the liver detected that way. Routine blood work done, liver enzymes are up. Let's do the ultrasound. We find a
Yeah.
tumor, you know, because liver's kind of involved in everything. And the body is the detoxification organ, right? The body is stressed in some way. Sometimes it's just things like oversupplementation or poor diet,
Yeah.
but sometimes that's a red flag for checking. I don't know. Do you have any other feedback
Well,
based on your experience on the testing?
yeah,
I know you've been through so much of this yourself.
I know. Well, I'm a purist and I used to believe I wouldn't want to do any testing because I'm like, what would I change? I'm already doing everything I know to be correct. What value would that information give me? But then I talked to Dr. Kendra Pope, who's an integrative veterinary oncologist, and she was recommending a lot of the same, like the nutrient testing, the inflammatory markers, things like that, because those kinds of they show imbalances and shifts earlier before imaging can detect the little mass. So she kind of changed my perspective a little bit on that, but I still come back to what would I change? How would that make a difference? I guess she was also recommending heavy metal testing and pesticide and glyphosate exposure testing as well. But again, I mean, it's going to give you that information. And if there's someone in your neighborhood spraying that you have no
Right.
control of, what are you going to do? So that's where
I
I
mean,
just lean in. We got to keep things as fresh and toxin free as possible and then try to support our dog's detox pathways as best
right.
as
And
we
that's what I think about some of the toxin testing. I mean,
Yeah.
I've heard something like 80% of humans, if you
Mhm.
have your urine tested, you're going to find glyphosate
Oh,
is
yeah. It's
everywhere.
everywhere. Yeah.
It's everywhere. So,
Mhm.
and I kind of agree on that stuff and like the heavy metals. We need to be the body does know how to detox. So the important thing is thinking about, are we feeding it appropriately so that we're
Yeah.
supporting those detox pathways? Maybe doing some liver support, some liver herbs. I mean, I think doing things like milk thistle and dandelion root, um, like for maintenance, maybe combination of those a week out of every month or something, just to give
Yeah.
the
Not every
liver
day, just
not
a little
not every
gentle
day.
support. Yeah.
If you're giving 20 supplements every day, I can guarantee you're overloading the liver and you're stopping its
Yeah.
ability to detoxify from these other things. And that's where it's so important to control the things we can control, because you
Yeah.
can't control what they're spraying in the skies. You can't control everything your neighbors are doing.
Mhm.
And sometimes you're limited on where you can take your dog on walks,
Yeah.
but you can control what's going in the food bowl. You decide whether or not your pets are getting vaccinated, whether they're getting heartworm and flea and tick and all these other chemicals.
Mhm.
So the fewer of those other chemicals that you put in your pet, it's going to be better able to handle the environmental toxins. But I do think there's advantage in like finding a tumor early, because there's things we can do. So when you say, what would I do differently? So when it
Yeah.
comes to toxicity, there might not be a whole lot. But if we find a
Mhm.
tumor early, there are things like, I introduce things like Chinese herbal blends. So Chinese herbs, I love Chinese medicine because it looks at patterns in the body. It is not based on a diagnosis.
Yeah, it's
Now I have
energetics, it's kind of closely related to homeopathy in a way.
it
Yeah.
is.
Yeah.
Exactly.
Mhm.
Exactly. And so very simply, if a tumor or a mass shows up, it's stagnation. We need to get the energy flowing in that part of the body. And then there's herbal blends that will direct that effect to certain areas. So if you have a mass on the skin, there's herbs that will have that effect on the periphery of the body. If it's in the liver, the spleen, or somewhere internally, there's different herbs that have effects in those parts of the body. So if you could get in, so you if you see a mass show up, say on the liver, you're like, okay, first thing, we correct nutrition. If you don't correct the nutrition, don't bother doing any of the rest of the stuff. In my opinion, you got to
I
start
know.
there.
Well, here's what's
'Cause,
interesting
I
about
mean,
that is so many, um, I guess there's not a whole lot of veterinary oncologists actually, but veterinarians in general, conventionally, one of the first things they say is, no, your dog can absolutely not have raw if they have a cancer diagnosis
I
or
know.
whether going through chemo. I'm like, this is the most important thing you could do for them right now is give them adequate nutrition.
I know. I
It's
know.
crazy. Yeah,
It's
I've
the
seen that a
most
lot.
important thing.
People are
The
terrified and
most
they'll
important
listen to
thing.
the vet. Yeah.
Yep. Yep.
Mhm.
Absolutely.
So, yeah,
And this is where
nutrition.
people, that's why it's so important that you're doing what you're doing, because people need to be educated, because if they have the information, then they're going to be empowered. So then when they go in and they hear the C word, they're going to be, no, wait a second. I heard Bre on her podcast. She said, so they have some foundation, because it is scary
Oh, it's
when
so
you go
scary.
in
Yeah.
and you get the word, and then you're like, okay, well, you're afraid to do the wrong thing. So you believe the person that's supposed to be the professional that's supposed to,
Mhm.
guide you.
Yeah.
But anyway, so introducing Chinese herbs that are very benign, just powders you put in the food, that can help. And then I do things like mistletoe therapy, which is an injection. Mistletoe has been used in human cancer patients for over 100 years. It was actually brought to light by Rudolf Steiner in the 1920s. And it's used extensively in Europe. So something like 70% of human cancer patients in Germany get mistletoe therapy. It's used
Yeah.
routinely. So there's
Yeah.
a lot of data. It just, we don't
And what
do
dogs are good candidates for mistletoe? Pretty much any dog with
any of
cancer?
them.
Yeah.
Any of
And
them.
it doesn't add
Usually,
any additional burden to the system. It just kind of helps
mm,
helps nudge the
yep,
immune system a little, right?
right. And
Yeah.
it does a couple different things. So it's immunomodulating. So it actually helps support normal immune system function. We talked about, cancer shows up, chances are the immune system's a little bit run down. So we want to build up the immune system, but at the same time, it reduces inflammation. So it's very balancing. It can also be used in things like autoimmune disease, but it also has direct anti-cancer effects. So if we had a tumor show up, if I get a little skin bump, there's levels of how aggressive I would be, because we can watch it. We can see what its behavior is. So I might start out, let's correct the diet, let's do some herbs, and let's just watch it and see what it does. If it shrinks and goes away, or it doesn't grow, it's not a problem. We don't need to do more. If we have a tumor on the liver or the spleen, that's potentially life-threatening, right?
Yeah. What
Really,
about like
this could,
osteosarcoma? Same deal.
osteosarcoma is another
Same
one.
deal.
Bone
Yeah.
cancer, super
Yeah.
aggressive with
Okay.
that. And that's very obvious. You don't have to do much testing, because if your
Yeah.
dog, usually people get an x-ray, but the dog's limping, and a lot of times you can actually feel a
Mm.
bump there.
And those
So,
grow pretty quickly usually, I feel like.
and they
Yeah.
can grow pretty quickly. That's one that's like, if you can get it early, I have seen some osteosarcoma patients where we've managed them for like up to 2 years, where we can actually control the pain enough. Pain's a real problem with that, because it's just so very painful.
Yeah.
And most of them need to be on conventional pain medication,
Yeah.
but I've seen some that we can keep it from has a high metastatic rate. It's another thing to consider. Certain types of tumors do tend to spread more. Osteosarcoma, very, very high metastatic rate. Most of your little skin lumps on the outside of the body don't tend to spread to the internal organs as readily. So I feel like we got a little time to
Yeah.
treat it, wait and see. Bone tumors, they spread to the lungs very readily. So
Sure.
catching those early, doing herbs, mistletoe, I'm big ozone therapy too, which
Yeah.
is basically oxygenating the body. I
Mhm.
really like that therapy. I wish
Yeah,
more
I did
vets were
that
doing it.
for Anne or both of my dogs. I did the mistletoe for Anne and the ozone therapy religiously. I bought the O3 Vets Hummingbird kit, which was not that expensive in the grand scheme of things. And I know that helped a lot.
Yeah.
Yeah.
You just can't go wrong. I think outside of, once we get past the nutrition and eliminating toxicity, if I had one therapy, it'd be ozone,
Okay.
because you're oxygenating the body.
Mhm.
It's never a bad thing. You're helping all the cells, all the
Yeah.
healthy cells, be healthier. You're helping their mitochondria. The cells are producing more energy. And most disease processes, including cancer, tend to thrive in low oxygen environments, because it's a compromised area, and you flood that area with oxygen, and you're actually helping make it less friendly for the cancer cells to grow. I'll even, like the skin lumps, inject the ozone gas just like right underneath the skin. You can inject
Yeah.
it like right around tumors.
Into the
You know,
blood, I was doing that with Skip, but going back to something you said earlier, I think there comes a point where you're so fearful that you end up doing too much, especially when you're going to the vet a lot for a dog that's already stressed out and struggling. That's one thing I wish I could change about my journey is, you helped me so much, but I was still doing things on my own, kind of panicked. And it's kind of a less is more. They really don't need to be bombarded with more stuff. Like get the basic inputs right. And like you said, just watch and see. But we get so fearful that we just want to throw everything and any supplement
yeah,
that says it helps support cancer, we're throwing it in the bowl too. And that's just more energy that our dogs' bodies have to use to figure out what that is and process that when they could be tending to the cancer.
right,
Yeah.
right. And how many trips to the vet? I mean, dogs don't like going to the vet. I
No.
mean,
Oh my gosh.
I've done, I've had a clinic where we did on-site ozone therapy. And the last time I did that, I actually had a home clinic. So the pets didn't mind coming in as much because it was actually coming into a house and they were, we made it, tried to make it kind of fun, lots of treats and lots of love. And the pets didn't mind it as much. But going into like a conventional clinic, and if your pet's stressed, if a treatment's causing stress, you really have to consider it might make you feel better up here, but you're really negating a lot of the benefit because anytime your pet's stressed, they're in that sympathetic mode and the body cannot heal. They're in fight or flight and they have to be calm in that parasympathetic mode in order to heal. So that's where like home treatments are great though, because you can
Yeah.
do rectal ozone at home.
Mhm.
Mistletoe, like I send mistletoe injections out to people and people
Mhm.
can do that at home. You don't have to go in to the vet for that. Um,
'Cause
so
they
I think
want they want
you have to
normalcy.
wait.
You gave me that advice, is your animal doesn't know that they have cancer. They're looking to you, and if you're sad and scared, they feel that so much, like you were saying at the beginning of the conversation. They feel even more than we do. The energetics affect them even more, so the less or the more normal you can keep things in their life, I think the better chance that they have. If
Right.
you're running to the vet for all of these treatments, like you said, it's just negating some of the benefits. Yeah.
Yeah. And sometimes like, I've seen with clients, people that have more resources that they can pay for lots of stuff and they're just every day almost they're taking their pets somewhere and you can just see in the pets like and the pets will tolerate it, but like those pets don't have better outcomes, even though they're doing all this stuff where people need to pick and choose and prioritize. Sometimes those pets do better because we're splitting things up. We're not overwhelming the body with so many things. So I think this energetic aspect is of disease is so important. I think it's so important for people and for pets. I can't tell you how many times I see like I'll do a blood panel and a pet's glucose will be sky high. It's like, well, your pet's a diabetic. Really? Like, we got three members of our family that are diabetic.
Yeah, yeah.
You see that sort of thing. Seizures. It's another one. Like a pet will have a seizure and they're like, people will come and say, my son has seizures. So pets really pick up on that energetic aspect. And we've all heard the stories about how people heal themselves through prayer
Mhm.
or with changing their beliefs about disease. And I think it's harder for us humans to realize that if we change our belief about our pet's condition, we can actually heal them. It could be
Yeah.
that simple. Yes, you have to stop poisoning the body. You have to stop putting the poisons in, but that's not hard. That's more stopping stuff. It's not like changing the diet. So you have to do something different there. But some of the other inputs are stopping toxins. And I think if you changed your belief, I think you could really help your pet more than most people
Yes.
more than most people realize. And it's not our nature, especially with the internet. You want to go find the thing. I want to go find the magic bullet. I want to go find the thing that's going to
Yeah.
cure my
I was
pet.
I was guilty of it, and I was trying all these little things, and it's too much. But you're
Yeah.
right, you need to have this regrowth mindset where you trust in the body's ability to heal itself. It's always trying to heal itself if you give it the room to do that and give it the tools to do that. We grow humans in our wombs, in our bellies, and bones come back together and the skin heals up. So the body wants to heal. And if we just
Right.
believe in that, I think you're right. I think it's such a hard mindset to get into when you're
Oh,
scared. I'm
it's right.
hoping if
And
I ever go through it again, I'll approach it with a much more calm mindset than I did the first time around. Yeah.
but you do, you get fearful. And I think
Mhm.
the most powerful way for people to get out of fear is to be educated. That's why
Yeah.
I'm like, I love doing podcasts, because I'm like, people just need to hear another side of the story, and they need to hear the information, um, so that they know there's another side. So when, the typical scenario I hear, and I don't know if exactly this was your experience, but people go in, you get the big C diagnosis, they're going to offer you potentially surgery, chemo, radiation. Those are the only three things they have. You don't want to do any of that stuff. Well, sorry, take your pet
All
home.
you can do, yeah.
Take your pet home, keep it
You're
comfortable.
you're only gonna live a couple of months
Yep.
without this conventional intervention. Yeah, it's exactly what I was told. And I was thankful that something in me knew. I had read a human cancer book, years prior, and I remembered that we don't want to mess with it. And fortunately, the vet who I showed the mask to on Anne's tongue, she knew right away between the smell and the look of
Hmm.
it. She knew right away. So there was no pressure to mess with it and try and like come up with a formal diagnosis or staging. And I just knew like we're not going to do that. So I guess that's good advice for people who go in and get this cancer diagnosis is usually you don't have to make any decisions right away either.
Right.
They'll kind of pressure you. I mean, I was guilty of this with my other dog. They'll pressure you, but you absolutely, so long as your animal is stable, don't have to rush into any decisions.
Right.
Yeah.
Right. And I think
Yeah.
that's really important, unless you're having, like a bleeding tumor or
Yeah.
something that's truly life threatening.
Yeah.
That's not the largest percentage of cases. In most cases, you can say, thank you for the information, take a step back, go take your dog for a walk, take some deep breaths,
Yeah. They're not going to
get
die
some more,
tomorrow. Yeah.
get some more opinions,
Yeah.
get other opinions. If you're like,
Mhm.
well, I heard, this podcast where they talked about this mistletoe stuff, maybe I
Yeah.
should go re-listen to that. You know what I mean?
Mhm.
Like, get all the information. I wanted to mention, because I get this question on almost every cancer case, the
Sure.
fenbendazole and
Oh,
ivermectin,
yes. Yes.
because I'm sure people listening are going to be thinking about that.
I
And
think it's this magic bullet. Mhm.
it's the magic bullet. And that's the first thing, is there is no magic bullet. Anytime I hear, oh, this is the thing for cancer, then nope. Because there is no magic
Because
bullet. Or
every animal arrived there differently, a completely different path, so there's never
right,
gonna be one way to unravel all of that. Never.
right.
Yeah.
Exactly.
Mhm.
And or causes. Cancer's always parasites. I've heard that one.
Yeah.
Like, no, there's never one cause. Could there be could it be a contributing factor? Perhaps, but then I hear another school of thought that says that parasites are in there helping to clean things up, that they're actually a benefit.
Mhm.
So that's another whole topic, the whole parasite thing. But um my I don't recommend ivermectin and fenbendazole up front. I've helped some clients use them that are just set on, they just want to use them. So
Yeah.
I'd rather have them have some advice. I don't work with people that like do chemo anymore, because I
Mhm.
feel like it's just poisoning their
Yeah.
body. Um, I can't say that I tend to see a lot of adverse reactions to ivermectin or fenben. I've seen a few dogs that get neurotoxicity from ivermectin, especially on high doses. So they actually get wobbly. So you have to be really careful. My biggest concern is effects on the microbiome.
Yeah.
So nutrition and gut health, the whole thing about, so part of what we recommend in nutrition is you have natural ferments. They're getting healthy bacteria. Dogs get it naturally just going out there digging in the soil that doesn't have glyphosate on it.
Yeah.
But that's where dogs get a lot of their, healthy bacteria in their gut. So for giving an antiparasitic on a regular basis, and some of these protocols are every day, how are we not killing off some
Good
of these
bacteria, yeah.
beneficial bacteria in the gut? And there's a lot of reports that say, no, that doesn't happen, and blah, 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 whatever. There's always a study that'll tell you what they want
I
you to
know.
think.
Yeah.
I don't believe studies hardly ever anymore.
Me neither.
I think most studies anymore are created with the result in mind, and then they build the data around that. There's very,
Support just
very
their
little,
yeah, yep,
very
lots of
little
bias.
true research. But so that's a big concern. And then fundamentally, they're pharmaceuticals, right? It just goes against my philosophy. Like, I believe that the body, health is the natural state of the body, and the best way to heal the body is to use things from nature, herbs. Mistletoe is essentially an herb plant that grows in the tree. Ozone's just oxygen. We're using things from nature. And anytime anything was taboo a few years ago, ivermectin was horse paste. You remember all the taboo about
Yes.
ivermectin during COVID? And now the information is just widespread. You can get it
Yeah.
anywhere. Like, anytime something stops being censored, I'm really suspicious of what they're putting in those tablets.
That is a
Like,
good point. That's a
I
very good
just,
point.
I just don't trust it. And then probably the biggest thing is I just never seen it turn a case around. There's all these reports about it, and I work with many cancer patients every week. That's one of
Mhm.
my specialties.
Yeah.
And I've never seen somebody start either one or a combination and seen it just turn a case around. So if it was just, you know, all that's supposed to be, then, why aren't these medications turning cancer cases around? And a lot of people that put information out aren't treating. Like, my first question for somebody that puts this information, how many cancer patients have you treated in the
Yeah.
last month?
It's all
And
just hearsay, really. Yeah.
exactly, they're reading
Yeah.
other people's data. So anyway, I just wanted to mention that because it's so popular these days. And sometimes, honestly, as a practitioner, I just roll with my gut on things. Like, that's just not sitting well with me. I just can't get my head around using those. I'm not seeing the results. Um,
And
so I
you
just
had
can't recommend them.
well, for ivermectin specifically, I think when I asked you about it, because I was curious too, I was
Hmm.
naive. I'm like, "Oh, would this work?" And you had mentioned that most of our dogs are on ivermectin monthly and the Heartgard
That
for their
too.
entire
Hmm.
lives. So really, if it does sh have add benefit to human cases, it's because maybe humans have a parasite load that's taking energy away from the body, because humans aren't deworming themselves every
Right,
month. So you
right,
you pointed that out to me, and that made a lot of sense. Where our dogs shouldn't really have a parasite load if that's what we're trying to
right,
target, because they're routinely wormed, most of them. I know
right.
mine were, yeah. So that
Very
made a
true.
lot of sense.
And I've heard some people on the human side say, well, if you have a pet, you've got parasites. But yeah, the average house dog, if you're following any kind of conventional health plan, they're getting dewormed all the time. So
Mhm.
that's really uninformed. And once I hear somebody say something that I know for certain is not true, then I tend to not trust anything. Well, then I don't know what to believe of what they say, you
Yeah,
know?
I know. Yeah, so I
So
guess
what else? What else
I
can we
don't
cover regarding cancer?
I think that's the most important thing is just people need to know that there's more options, go in, you get the diagnosis, try not to poke and prod, don't rush into surgery unless it's life or death, and seek out help from veterinarians like yourself and try some alternative therapies. And I know so many people will still be feared into doing surgery at a minimum or chemo radiation because it's just ingrained in us that we want it off of our animals. I think you explained this too, that the tumors bother us more than them for the most part. Especially when you
Hmm.
can see them. It's in our
Hmm.
brains that we just want to cut it off. We just want to get rid of it. But as you know, it doesn't help the case. If a dog is living fine with it, it can be there. A dog can coexist
Right,
with the cancer. We can slow it. We can, in best case, start reversing it a little bit. But it's just getting over our own human perception of things.
right,
Usually,
right.
yeah.
And I find the biggest successes are that mentality of, can we help the pet live with the cancer? If our only objective and the only thing we'd be happy with is if this cancer completely goes away, that can be difficult to achieve because, number one, it can involve surgery, which causes very aggressive. So
Yeah.
I guess I didn't really talk too much about
Yeah.
surgery,
Let's
but
talk about that. Yeah.
for something life-threatening,
Hmm.
like, you've got a tumor on the spleen that's bleeding
Hmm.
and the dog's going to bleed out if you don't remove it, then you kind of have no choice. But for most, like, skin lumps and bumps, um, for my biggest concern with those is regrowth. So I've seen so many, especially mast cell tumors, had so many cases where people will remove a little mast cell the size of like a tip of your finger or a pencil head or something. And it will regrow with a vengeance. Like it'll come back in multiples and just like bizarre alien type growth. I mean, just like overwhelm that part of the body. It's just crazy how I've
Yeah.
seen these things regrow. And I used to be that vet that like lump shows up, let's get rid of it.
Yeah, let's
Gone
make sure we
is
have clean
good.
margins, we'll get rid of it.
Right. But
Yeah.
even with clean margins, I see them regrow, and regrowth is so aggressive. And part of that is, you do surgery, you're creating a whole bunch of scar tissue. So we talked about the body needing to get into that area to heal, to bring circulation, to help, allow the lymphatics to come in and drain. And once you create all that scar tissue, the body can't do that, especially if you remove lymph nodes. I mean, I've just seen some horrific cases where they do surgery and remove lymph nodes, and then it grows back, and it's like, you're kind of done at that point. Those are really, really hard to treat. So unless something is directly life-threatening or blocking a bodily function, they can't pee or poop. I mean, you got to do something, right? There's still the risk of regrowth. But I mean, it was a kitty, but that had a complete obstruction from a bladder tumor, and they had the surgery because they wanted to try to treat it. But you can't remove the whole bladder, so you're always leaving some cancer cells behind. This cat lived 5 years. As a matter of fact, her cancer never came back.
Wow.
It was like one of the most amazing cases, and we did all the stuff, did the nutrition, the herbs, and ozone. As when I had an on-site clinic, and we were doing rectal ozone and all this stuff on the kitty, and had multiple follow-up ultrasounds. Never regrow. The only thing they ever saw there was some scar tissue from where the surgery site was, and she lived to be into her teens. I think ended up passing away with a heart condition or something unrelated to the cancer. So it can happen, but in a case like that, like you have no choice. You have to do it. But aside from that, I don't recommend removing them. Oral tumors, like Anne said, I think have a particularly high regrowth rate because you can't remove all the tissue very effectively without. I mean, she had it on her tongue.
Yeah, they'd have to move parts of her jaw and her teeth. It was just, I was never going to do that. Yeah.
When it gets to those kind of surgeries, that to me is just because we can, doesn't mean we should. Like to me that to me that just takes too much away from the quality of life of the dog, because dogs love to chew and eat and all that stuff.
I know, poor girl.
So I think, you manage it the best you can. Oral tumors are really challenging because of the location, because it can interfere with eating. If it's up top,
They have a
breathing,
bleed,
and they bleed, they make a mess, they're particularly challenging. So I always feel really bad when people come in with those, but yet, I've seen some maintain, and, we do what we can. There's always hope. I mean, I think that's my approach is I try to really be realistic with people. If I feel like we're starting pretty far behind the ball, and sometimes we are, I'm always honest with people about that, but I feel there's always hope, and we can always try. And if we can give the pet a couple of weeks, if they're already like not wanting to eat and pretty run down, give them a couple good quality weeks, then, we've done that for them. We can't, I think sometimes our pets are here for particular journeys and to teach us particular lessons, and they're not always fun lessons to learn.
No. I certainly learned a lot of lessons from those guys. Yeah, I remember back to Skip's case, and I still go back and forth with him because, he stabilized. He had he had a little bleed that made him a little lethargic. He didn't eat, and that's why we brought him in. And then he was back to his normal self by the next morning before that surgery they forced me to schedule. And I'm like, oh, what I wouldn't give to just walk him out of there at that point. I could go back in time because his body, obviously, we were supporting him well with the diet. And I feel like his body did what it was supposed to do because I'll tell you, his cancer spread so fast. And when you think about it, they removed the spleen. And then while she was in inside of him, she noticed a little nodule on his liver. So she biopsied that. And
Okay.
then, he was 3 nights in that miserable place in a crate in the middle of the chaos. They wouldn't let me bring his raw food in, of course. So, all that stuff just really takes a toll on them, and I think that's why things just blew up with that poor guy. But
Yeah.
but yeah, having
Yeah.
a sarcoma is a tough one because it's very scary when you learn that your dog could essentially bleed out internally at any point. So,
Right.
that's a really
Right.
tough
And
one.
you just never know what. It's a hard one to live. I mean,
Yeah,
I've had clients live with it. I've had quite a few clients get the splenectomy surgery done, and the dogs
okay.
have lived for years too.
Yeah,
So,
yeah,
you know, you just don't know. But I think in general, I think something that's really important for people to know or to kind of think about when that tumor shows up and you get so hyper focused on I just want it to be gone, you have to go back to thinking that why did it show up in the first place?
yes,
And
yes,
for everything you're doing for your dog and the diet, there's a certain set of conditions that cause that to show up. So if you can take a step back and like maybe, you'd end up doing the splenectomy anyway, but take a month and say, what conditions can I correct? Because if you are going to do surgery, the healthier your pet is going into it, the better
yeah,
their chances,
yeah.
So and I know it's when you're so afraid, none of us can make good decisions
No.
when we're afraid, but that's why I bring this up now. Just remember,
Mhm,
they're going to tell you your pet's going to die if you don't do this surgery right now.
mhm.
That's what the conventional vets,
Yes,
they put that fear into you because fear is very motivating. But if you think about, well, what caused this tumor? How is my pet compromised that this tumor showed up in the first place? And maybe I need to take a step back and start correcting anything I can correct before taking a big step like a surgery or something,
yeah,
just try to think about things just a little bit differently.
absolutely. Yeah. Any other piece of wisdom you wanna add on the cancer topic?
We hit a lot in a
We
little over
did
an
hit a
hour.
lot. Yeah, we did
Um,
great.
I, I think just for people to remember health is the natural state of the body. Health is not created by the medical system, and your pet's body's always going to want to go back to being healthy. And it's sometimes about removing things, not adding more things, and the things you add need to be very targeted to help specific
Yeah, don't
condition. And
throw
if
the
you're feeling
kitchen sink at them. Yeah.
don't throw the kitchen sink at
Yeah.
them. And if you're feeling afraid, try to take a step back and get your pet, if you can, like get your pet out of the hospital, get him home, spend some time. Trust your intuition. Nobody knows your pet better than you do. And if you can get out of fear, just spend some time with your pet. And what's your gut telling you? What's your gut telling you about the situation? And there's so much information coming in from all the Facebook groups and
Mhm.
everything, but no two pets are alike, and you know your pet better than anybody. So believe that your pet can heal and trust your intuition.
Yeah, I think that's a great way to end. Thank you so much.
Okay. You're so,
You're
you're so
amazing.
welcome. It's so much fun. I really enjoy doing these.
I know, me too. We're gonna have you back to talk vaccines. I'll just get everybody prepped on that.
Yeah,
Thank you,
let's
Dr.
do it.
Jasek.
Okay. You're welcome. Have a great day.
All right. Per usual, I love to come back and just bring everything home. Dr. Jasek is so gracious to give us more of her time. She is so passionate and so experienced, and I just can't get enough of learning from her. I'm going to link a few of her resources again down in the show notes and trying to have more cancer specific resources, but also linking that amazing rabies vaccine webinar that she did. I think it was a couple of years ago. It's incredible for those of you who are looking to learn more about that awful vaccine. And hopefully we'll chat again in the near future and really dive into vaccines for those of you who like to nerd out a bit, like nerd out over it like we do. Thank you guys again for being here. And again, I apologize for being a little bit under the weather. I'm going to continue to drink lots of fluids. I've got lots of herbal teas and bone broths, do some homeopathy and just relax. I think my body was just like, you're doing way too much. We're getting ready to go out west again for a big chunk of the summer. So maybe just the stress of trying to tie up loose ends before we do that is all catching up to me. And goodness, I still had a workout class this morning that I refused to lose my money on and I didn't want to miss it. Forced myself through that, which is probably not a good idea. I needed to listen to my body. So I'm doing that now. I'm going to take a rest and love your dogs.